Hello, this is Dr. Kavian Milani for Virginia Medical Updates. In the previous section, we did talk about obesity, and in this session, I do want to address the issue of obesity, why it's more prevalent in society today, and some ways in which we can conceptualize and understand the rising epidemic of obesity. As you know, as we all know, obesity leads to hypertension, hypercholesterolemia, it leads to renal disease, it leads to liver problems, and it does lead to a variety of cancers. In general, it is very important for physicians and for the patients and for all parties that are interested to begin to conceptualize this issue of obesity along the spectrum of other medical problems. The issue is not really losing weight or to just basically look good. The issue is that the processes of obesity, the process of weight gain, of excess weight, does actually lead to significant medical problems. And we, in this program, want to bring this awareness to the community. And I want to be able to engage in a dialogue with the community on how to tackle the issues of obesity and weight gain. If a person wants to lose something akin to 10 pounds, for example, we have to keep in mind that every 1 pound that we want to shave off, that we want to get rid of, every 1 pound is equivalent of 3,500 calories of energy that we must either not consume or we must burn. Well, for every 1 mile that one jogs or runs, one can only burn about 100 calories. So it stands to reason that to burn 1 pound, one has to jog something akin to 35 miles. And that is a significant amount of calories that one can burn, but at a very, very difficult rate. So it is important to notice that any weight loss program has to be balanced between losing calories and increasing muscle mass and burning fat, but also in terms of reducing the intake of calories. A number of programs have been very successful. A number of commercial programs have been very successful. A number of fad diets have been very successful. And in general, any of these programs, if maintained and if accompanied by adequate hydration and by adequate exercise, can lead to sustained, successful weight loss. But the difficulty is this, is that as one loses 10 pounds of weight, the hormones in the body begin to move to produce homeostasis, and the two hormones that I'm thinking about are leptin and ghrelin. And these hormones, their levels begin to go up, they begin to slow down metabolism, they begin to actually increase our requirement for eating, and they force us to become ravenous and eat more and more. As this happens, then weight loss becomes much more difficult to maintain. And so a number of tools are available for physicians to use to manage this surge in ghrelin and this increasing in appetite. In addition to the medical and pharmacological management, normal substances that are available, like green tea, like lightly brewed coffee, like a variety of peppers, are available to enhance metabolism. And as they enhance metabolism and increase the metabolic rate, it becomes easier for the body to actually burn some of these calories off. The CDC now recommends, and it's important, that if one wants to engage in intense physical activity, that a total of 75 minutes per week is used. And that then has to be accompanied with some activity like in the form of jogging or running or singles tennis, which is intense, and then weightlifting and weights to be added to it. But for moderate exercise, then, which burns at a lower rate, then the CDC recommends a total of 150 minutes per week. And again, this is like doubles tennis or it is fast-paced walking, during which one can burn calories. So at a rate of 150 per week, then that's about 30 minutes, 5 days a week. And my experience has shown that if someone is actually walking at a fast pace for 30 minutes, 5 days a week, that they will lose weight and will bring their weight together and increase their body mass in an appropriate way. In the next program, I do want to address the issue of prediabetes and hypertension and how significant weight loss can contribute to preventing these disease states. Thank you for your participation with us. We look forward to hearing from you at 703-383-4VFM or on our Facebook page or through Virginia Medical Updates at gmail.com. Thank you.